Hey, this video is for you if you or anyone you know has been diagnosed with Dupuytren's Contracture. What that is it's actually a really thickening of the tendon and the muscles that go into your fingers. So you might recognize it as someone who has kind of a contracture right there, or maybe their fingers even all the way pulled down. In the allopathic world, you'll go to your doctor and they'll say, well, come back when your finger doesn't move. In my world, I went and found a massage therapist practitioner who actually had her PhD in Dupuytren's Contracture. So these are the three things that stuck out the most with how you can prevent your finger from going all the way down like this, and how you can improve circulation and flow. This is my favorite tool. That's why I have many here at the office. It's fabulous because, well, if you don't have this guy, you can just use a roller, like a bread roller, a dough roller. This is what I use it for. You can just hang out like that, rolling for a good 2 minutes at least, maybe even 5 minutes, doing both sides. It's especially important for the Palmar Longus muscle. And so that's kind of in there. Usually you can find it's really, really thick. So people prone to Dupuytren's Contracture often have really dense ligaments and tendons, and so they're not prone to spraining their ankles, but they are prone to things like Dupuytren's Contracture. So I've never actually had it so bad where I even got the contracture, because I'm usually able to keep it at bay. Started as a little painful nodule that I noticed, especially working, and if it got rubbed the wrong way, it was quite painful. So if those are your symptoms, please heed my warning. You don't want to go and wait until your doctor's going to go surgically cut the tendon because it's so bad your finger doesn't move. Let's do preventative care, not crisis work. So roll your forearms out 2 to 3 minutes. On top of that, you're going to want to ensure your elbows are bent, and you're going to want to try to have your whole palm flattened out. Wow, that looks really bizarre in the camera there. Anyway, most times people with this start of the contracture, they're not going to be able to do this very well. They're going to want to straighten their arm. This is getting more into the bicep, so we're missing the major muscle that is causing the dysfunction. So you're in the wrong joint. You want to be more in the wrist joint. So have a bent elbow, maximize the space to try to stretch that guy out. Reason I'm doing this video is because I've been having some symptoms again, and it's a little bit painful in my wrist, and so realize I haven't actually done this in a while. So the kicker here, so bent elbows, hopefully you can see that in the video there. Bent elbows, flat hands, trying your best to work your way downwards. If you're up here, that's okay. If this is the stretch, this is just where you're starting. You're going to want to work your way down to having flat palms. As you can see, my palms today are not flat, especially the right one, which is where I'm getting my symptoms most prominently right now. So you want to keep your elbows bent, your wrists bent, flat palms as best as possible, and you want to hang out here for 3 to 5 minutes. Seems like a long time, but there's no better way to soften this tissue other than to hold it for a long stretch. If you're prone to ligament laxity, long stretches are not for you. Passive long stretches are not ideal if you have laxity in the ligaments versus tonicity, which is what people with Dupuytren's Contracture will experience. So hold this for 3 to 5 minutes. I'm going to just fast forward time in this video and just pretend like I had done that for 3 to 5 minutes. What you can expect is, as you come back, it's going to be quite uncomfortable. So give yourself maybe a little bit stretch the other way, especially if it's been a while since you've done this stretch. It's intense. So do expect that. Little tiny circles will help relieve that. It should really only last a few seconds. Do this 3 times a week. You're going to really see improvements in a month. Thank you.